What's going on, everyone? It's Alex here from Alex Physio. So today we're going to be going over 5 tips about sciatica that you probably didn't know about. Welcome. To those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia, and today I'm going to be going over 5 tips about sciatica that you probably didn't know about. So let's get right into it. Tip number 1 is centralization is a good indicator that you are recovering. What is centralization? It's basically when the symptoms, the area that the symptoms are covering, are getting smaller and smaller. That's a sign that you are healing and you are getting better. So if the pain traveled all the way down to the bottom of your foot initially, and now it's only traveling down to your calf, and then eventually to your knee, eventually to your hamstring, eventually to your buttocks, to the point where it's only in your low back, it means that the area that the symptoms are covering, or the distance that the pain is traveling, or numbness or tingling, is getting smaller and smaller, which is a good indicator that you are getting better because the nerve isn't being as irritated theoretically, and as such your symptoms aren't traveling down the entire length of where that nerve is responsible for. Tip 2, the most common test that we use to determine if there is possibly a sciatica is the straight leg raise test. So what this involves is basically you lying on your back or even in sitting and just trying to straighten your leg either on your own, or the therapist or the practitioner lifting your leg up for you. The key is that if your therapist is lifting it up for you, that you're nice and relaxed, and if you're doing it on your own, that you're recognizing, is this reproducing your pain? Sometimes it can reproduce back pain, but is it reproducing your sciatica pain? That test is a pretty good indicator that your nerve in your back is being irritated from this test, this straight leg raise test. Of course, there are individuals that can have irritation of this nerve who also have something called piriformis syndrome or deep gluteal syndrome, but generally a good indicator to determine if you have sciatica based on this test called your straight leg raise test. Of course, the best way to find out if you do have a sciatica is based on your MRI and the correlation between the MRI and your symptoms, but this is the best test to do in the absence of any imaging. Tip 3, most people, about 90% of people, do get better within the first 3 weeks to 3 months. So this is reassuring in the sense that people can get better, and the large majority of people do get better with time and your body having a tremendous ability to heal. Of course, those first few weeks are going to be very tough, very painful generally, if it is a true sciatica, but knowing that time and natural course of the healing is on your side. If you've had an acute episode of pain or numbness or tingling going down your legs, that's diagnosed as sciatica. Of course, there are some people who don't get better, and this is where then you would look at further treatment options to try to see, what can be done about it, and investigation. So whether that be getting an MRI or a CT scan, or looking to see if there's a role for any sort of injections like a selective nerve root block or an epidural injection, or determining if there is a role for surgery based on the results of the imaging. Tip 4, there are other conditions that can mimic sciatica, so it's important to rule those out. So the things that I mentioned before, like the deep gluteal syndrome, or sometimes commonly known as piriformis syndrome, but more accurately deep gluteal syndrome, can mimic sciatica. So the difference between the two is you're basically trying to determine where is the pinching occurring, or where is the nerve being irritated. Is it being irritated in the spine, or is it being irritated once it exits the spine and travels down your leg? And another common source that it is irritated is around your buttocks region, because the sciatic nerve travels through some of those muscles in your buttocks, commonly in your piriformis, but also in some of these other muscles deeper in your buttocks, that it can be irritated in that area. So it's important to try to determine where's the irritation coming from, and there can be a lot of overlap between the symptoms, which also makes it tough to be able to distinguish. That's where getting an MRI can help to try to distinguish between the two. And another condition called peripheral neuropathy, so where you have damage to the nerves itself, not necessarily because they're being pinched or irritated, but just damage to the integrity of the nerves. So individuals who have things like diabetes or chronic alcoholism, or if they've undergone chemotherapy or radiation therapy, these are things that can affect the health of the nerves as they travel down, not due to any sort of compression. So it's important to try to rule those out. One of the ways that can help to rule this out is to see a neurologist and have EMG or nerve conduction studies performed to determine if this is coming from the low back or if it's coming from another condition, if you have another past medical history that may be causing the pain in your legs, traveling down your legs, or numbness or tingling or weakness. Number 5 is nerve level matters. So it's important to be mindful of the fact that everybody who you see, or if you've read online, if you have pain in your legs, it's sciatica. But for us, the scientific term for that is a radiculopathy. And the key thing with the radiculopathy is it's important to know which level is actually irritated, because the sciatic nerve branches off numerous different levels in your back from L4 to S3, and it's important to know, is it an L4 radiculopathy? So is the L4 nerve root being pinched? Is it an L5 radiculopathy, or is it an S1 radiculopathy, or S2 or S3? But most commonly, individuals who have sciatic nerve irritation happens at the level of S1. So important to know that each nerve, depending on what level is affected at, generally will cause a pattern of where the symptoms are to vary based on the nerve that's being irritated. So for example, if you have an S1 sciatica or an S1 radiculopathy, then people will generally have pain and numbness, tingling and or weakness traveling down the back of the leg, down the back of the calf, into the Achilles and the bottom of the foot. But if you have an L5 radiculopathy, which is the level above, then generally, not always, because these dermatomes are called dermatomes, they don't always follow a certain distribution, there's a lot of overlap. But if it's an L5 radiculopathy, then the symptoms are more commonly traveling around the outside of the leg, down the outside of the calf. And then if it's an L4 radiculopathy, less common than an L5 or an S1, then the symptoms tend to travel down the inside of the leg and into the inside of the ankle. So it's important to know that the layman's term for pain going down your leg is most commonly referred to sciatica, but for us, the scientific term is the radiculopathy, and specifically the specific level plays a role in determining, where's the nerve being irritated if it is a true sciatica, which will subsequently help to guide treatment if your conservative treatment doesn't work. So if you're looking at injections or even surgery, they need to know what level is being irritated, and they'll figure that out based on checking your reflexes, checking your strength, checking your sensation, and looking at, of course, the MRI and asking you where the symptoms are traveling. So there you have it. We went over 5 tips about sciatica that you probably didn't know about, but maybe you did. Also, let me know if you have sciatica. What have you found that has worked for you and what hasn't? Let me know down below. Did you ever end up getting surgery? Did you get injections? Did you just get better with physio? Did you get better without doing anything at all, just on its own? Let me know down below. I'd love to hear your story. And if you found value in this video, please consider checking out some of my other videos. I have over 500 videos on various physio, exercise, and medical related topics. And if you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.